It's unfortunate, but it's a fact of life that most people are going to suffer back pain at some point. Usually, of course, that gets better with a little bit of help from an osteopath or a similar therapist, but sometimes it just won't go away. And for many people, back pain can make life almost unbearable. I run the Academy of Physical Medicine here in Higham Ferrers, and we've set up a specialist spine centre providing non-surgical spinal decompression, a treatment known as IDD Therapy, which is really effective in dealing with those long-term back or neck problems. It's particularly useful if you have a pain as a result of nerve compression, perhaps from a prolapsed disc, a slipped disc in other words, or sciatica where the pain shoots down your leg. If the problem's in your neck, you might get that tingling in your hand or your arm, and no amount of heat or cold or physical therapy seems to give you lasting relief. You might have been told that the only option left to you is surgery. So that's where spinal decompression comes in. Treatment works by applying a gentle pulling force called traction to the very precise segment of your lower back or neck which is causing your pain. This traction is very carefully controlled and it helps to mobilize the affected joints, which is really important for that healing process. It can help to relieve the pressure on the discs and on the spinal nerves and on the small joints of the vertebrae themselves, all of which could be causing that pain. A key benefit of spinal decompression is that we can adjust and focus the forces on exactly the right level of the spine, and we do this using precisely measured angles. Typically, treatment on the IDD machine lasts for approximately 26 minutes, and during that time there are 13 cycles when the joint is fully distracted, and at that point a gentle oscillation occurs, something which is unique to IDD therapy and which helps us to achieve the best pulling forces without causing you any discomfort. The treatment is so relaxing, in fact, that quite a few patients actually go to sleep. In addition to the IDD therapy, as the treatment progresses, you'll also be advised on simple exercises to help strengthen and stabilise your back or neck, leading to lasting pain relief. The number of treatments you'll need is very difficult to predict. No two back pains are the same after all. But what you need to understand is that we're trying to make changes to the tissues around your spine here, and spinal decompression is not a quick fix. Your back or neck pain has probably taken years to get to its current state, and it's not going to go away overnight. You might get relief straight away, but it's more likely to be at least 6 sessions before we start to see lasting, real meaningful improvement. However, at the end of your course of treatment, it is very likely that you'll get good long-term relief. And what's more, if the pain shows any sign of recurring, 1 or 2 top-up sessions will probably be enough to sort you out. So what do you do now? The best thing is to ring us here at the Academy of Physical Medicine. What we'll be able to do is to advise you on how best to start your course of treatment, and what's more, we'll be able to tell you if we think that spinal decompression is the wrong approach for you. The number's on the screen, so now it's over to you. Give us a call, let us help sort you out.